Well, I'm an old medical practitioner, been in medical practice now for over 45 years. I founded one of the first and best health insurance companies in Nigeria. "20 years ago, there was no health insurance in Nigeria. 25 or so years ago, or 30 years ago, some of us who were in private practice, private medical practice, formed the Guild of Medical Directors. At the Guild of Medical Directors, we tried to look at the business of medicine, tried to look at the practice of medicine and delivery of services of medicine as a business. And we saw that medicine is a business on its own. And if you don't handle it like a business, it will not be sustainable. Then we looked and saw that one of the major things was how we financed health care. And we did our research and found out that in Nigeria, at that time, about 85 to 90% of the total money that goes into healthcare was money that people used from their own pockets. We call it paying out of pocket expenses in healthcare accounted for that high percentage. And we discovered that that is a very, very retrogressive and catastrophic way to pay for healthcare, because it only means it's when you are sick that you get to the hospital that you are told this thing is going to cost you this much. And since nobody ever prepares for that, it is one of the number one causes of continuing poverty, cycle of poverty in the whole world. Because all of a sudden, let's say you're an individual and you fell ill and they took you to hospital and they say it's going to cost $500,000 naira. Can you deposit half of that now? Many people will not have that amount of money. So even if they have to go and borrow, means you have started a problem with borrowing. The College of Medicine Alumni Awards was instituted recently to encourage networking, encourage excellence, and encourage a feeling of belonging or back to the college where we all graduated from. Alumni are all over the world. The training they received at that institution is what made them, or what was the foundation of their professional lives wherever they are now across the world. And people, you want to remember where you came from and give something back. So the more the years roll by, the more the members of the alumni increase, and the more the more prosperous they become, the more they would like to give something back to their college. In the health industry, we remain a vibrant leader in HMO, but the health industry itself is not doing well. So if it's not doing well, you can't say we are also doing well, because the total number of people in any form of health insurance in Nigeria is less than 4 million lives. And we say we are about 150 to 200 million people. So you can see that that's an absolute disaster, absolute failure in terms of the political will of the government of Nigeria and the people of Nigeria to institute a proper health financing model to deliver health care in Nigeria. And we also know healthcare facilities are very expensive. They need to be paid. They need to earn revenue to be able to be sustainable. So even if you went to build the best hospital in the world in Nigeria today, it may not be sustainable if there is no insurance to finance those who go there to receive care.